Health is an area of great promise but also great frustration. There seems to be plenty of low-hanging fruit available, from vaccines to bed nets. That could save lives at a minimal cost, but all too few people make use of such preventive technologies. Government health workers, who are in charge of delivering basic healthcare services in most countries, are often blamed for this failure, not entirely unfairly, as we will see. They, on the other hand, insist that plucking these low-hanging fruits is much harder than it seems. In winter 2005, in the beautiful town of Udaipur in Western India, we had an animated discussion with a group of government nurses. They were very upset with get them to come to work more often at us because we were involved in a project that aimed at some point in the proceedings. One of them got so exasperated Zasper erad that to them with. She decided to be blunt. The job was essentially pointless. Anyway, she announced. When a child came to them %, diarrhea, all they could offer the mother was a packet of oral rehydration solution, or ORS, a mixture of salt, sugar, potassium chloride, and an antacid to be mixed with water and drunk by the child. But most mothers didn't believe that ORS could do any good. They wanted what they thought was the right treatment, an antibiotic or an intravenous drip. Once a mother was sent away from the health center with just a packet of ORS, the nurses told us she never came back. Every year, they saw scores of children die from diarrhea, but they felt utterly powerless. The 9 million children who die before their 5th birthdays each year, the vast majority are poor children from South Asia and sub-Saharan Africa, and roughly 1 in 5 dies of diarrhea. Efforts are underway to develop and distribute a vaccine against rotavirus, the virus responsible for many, though not all, of the cases of diarrhea. But 3 miracle drugs could already save most of these children. Chlorine bleach, for purifying water, and salt and sugar, the key ingredients of the rehydration solution ORS. A mere $100 spent on chlorine packaged for boss prevent 32 cases of diarrhea. Dehydration is close to being free, is a wonderfully effective way. Main proxy cause of death from diarrhea and ORS. To prevent it. Zambia, thanks to the efforts of Population Service. Available at the cost of 800 kwaches, so $0.18 USD PPP. Chlorine nor ORS is used very much. Yet neither. In International, PSI, a large organization that markets it at subsidized prices worldwide, chlorine is cheap and widely. Family of 6 can buy enough bleach to purify its water supply, avoiding waterborne diarrhea. But only 10% of families use it. In India, according to the United Nations Children's Fund, UNICEF, only 1/3 of children under 5 who had diarrhea were given ORS. YAE. So, 1.5 million children dying every year of diarrhea, a disease that could often be avoided in the first place, and could often be treated with boiled water, sugar, and salt. Bleach and ORS are not unique examples, there is other relatively low-hanging fruit with promise to improve health and save many lives. These are cheap and simple technologies that, if properly utilized, would save much in resources, in terms of extra days worked, less antibiotics used, stronger bodies, and so on. They could pay for themselves in addition to saving lives. But too many of these fruits are left unpicked. LT is not that people don't care about their health. They do, and they devote considerable resources to it. They just seem to spend money elsewhere. On antibiotics that are not always necessary, on surgery that comes too late to help. Why does it have to be this way? In a village in Indonesia we met Bu Emtat, the wife of a basket weaver. A few years before our first eating. In summer 2008, her husband was having trouble with his vision and could no longer work. She had no choice but to borrow money from the local moneylender 100,000 rupiah S18.75 USD PPP to pay for medicine so that her husband could work again, and 300,000 rupiah, 856 USD PPP for food for the period when her husband was recovering and could not work. 3 of her 7 children were still living with them. They had to pay 10% per month in interest on the loan. However, they fell behind on their interest payments, and by the time we met, her debt had ballooned to 1 million rupiah, 8,187 US dollars. PPP, the moneylender was threatening to take everything they had. To make matters worse, one of her younger sons had recently been diagnosed with severe asthma. Because the family was already mired in debt, she couldn't afford the medicine needed to treat his condition. He sat with us throughout our visit, coughing every few minutes. He was no longer able to attend school regularly. The family seemed to be caught in a classic poverty trap. The father's illness made them poor, which is why the child stayed sick. And because he was too sick to get a proper education, poverty loomed in his future. Health certainly has the potential to be a source of a number of different traps. For example, workers living in an insalubrious environment may miss many workdays. Mothers who give birth there may have sickly babies. Each children may be sick often and unable to do well in school. Of these channels is potentially a mechanism for current is fortunes to turn into future poverty.